Hello everyone, welcome to StudyIQ English. In the news right now is public health and well-being as we are talking about Gavi, the Vaccine Alliance and UNICEF. Together these agencies have announced a new agreement that will make the R21 Matrix M malaria vaccine more affordable, significantly more accessible to the poor children across the world. The idea is to combat a disease called malaria, a vector-borne disease which is responsible for a very high number of child death, a very high child mortality, especially in the poor communities inhabiting the tropical regions of the world. And now, with this new agreement, there is possibly the intention of making this vaccine more accessible to those children who are often the victims of this one of the most deadliest infections in the world. So now let's have a look exactly at how this development will make a change to public health across the globe. Now looking at Gavi, the Vaccine Alliance and UNICEF, the Children's Fund, United Nations Children Fund, they have announced together a new agreement, and under the agreement, the specific vaccine R21 Matrix M, that's a malaria vaccine, will now be much more cheap. If it's cheap, the idea is also to make it more accessible to the poor communities across the world, because the intention aims to reduce the cost of the vaccine per dose to about $2.99, which is quite cheap, and it will mean an overall saving of about $90 million. These savings can then allow various poor countries, developing countries, to secure more than 30 million extra doses in just the coming 5 years. Now do also remember that within the next 5 years, 2030, we are also hitting the deadline for Sustainable Development Goals. And which Sustainable Development Goal typically talks about public health and well-being? So that is Sustainable Development Goal 3. And if you talk about the goal 3.B, the 3B, that specifically talks about access to subsidized, cheaper and much more accessible vaccination across the world. So that's why these next 5 years are very crucial, and the deal is financed by Gavi through an advance payment method enabled by International Finance Facility for Immunization mechanism. A very important topic also for GS Paper 3. Health, Nutrition and Science, as well as GS Paper 2, International Relations. Now, looking at nearly how many people die annually because of diseases like malaria, chikungunya, dengue, all these vector-borne diseases spread primarily through mosquito bite. So now, malaria remains one of the world's deadliest infectious disease. As of 2023, if we look at the data, it shows that estimated 5,97,000 deaths happened. Majority of them are young children in Africa. We often also say that Africa and Asia are two places which might witness the highest urbanization, the highest industrialization by 2045. This is a broad estimate given by UNDP and the World Bank. Why do we say so? Because both these continents have a great youth bulge. We know they experience demographic dividend, which is not the case with other mature developed countries. And if these many young children are experiencing a premature death, it definitely means a wastage of that youth bulge. Now, a child dies from the disease roughly each minute. So that shows the serious and that shows the very, very grim nature of malaria. Now, both WHO, World Health Organization, they recommend that malaria vaccines, the one that we spoke about, R Matrix M and RTS, have been shown to reduce malarial cases by more than half in the first year after being vaccinated, and there is further protection also available to people if they take a booster dose. Now, one of the other ideas behind World Health Organization is also to make sure that no child, even in the poorest countries, is zero dose child. That means at least one dose has to be given to most children when it comes to serious diseases, one of them being malaria. Now in India also this relates really well with the mission Indradhanush. If you have heard about the mission, can you please tell me in which year was it launched in India? That's a very good question for revising. And now coming back to Gavi, the Vaccine Alliance, we all know that it was created in 2000, a partnership that was intended as a public-private partnership. The idea was to improve access to new, underused vaccines for children who are living in the poorest region in the world. This also reminds me of how recently in the news we were talking about Palestine, the Gaza Strip, and how children are being bereft of basic immunization. Similarly, we also spoke about Sudan. Owing to prolonged civil war, there is a very high degree, a very high incidence of children who are zero-dose children. They haven't received any vaccine for various diseases so far. That points out to the importance of initiatives like Gavi. Now, it is based in Geneva, in Switzerland, and Gavi, the idea behind Gavi is to bring together public and private sectors with a shared goal of creating equal access to vaccines for children, no matter which area of the world they inhabit, specifically problematic areas like conflict-prone zones and areas that are more susceptible to climate disasters. Now, since the beginning, Gavi has vaccinated more than 1.1 billion children and saved about an estimate of 18.8 million lives as per the data of 2023. It also tries to create a coordination in developing country as well as the developed donor countries, the countries who are financing and the countries who are receiving. It tries to create a joint platform for them. The World Health Organization is a key member, UNICEF a key member, World Bank. All of these work together under the Gavi initiative to provide more research, to provide more funding, more development of newer vaccines, or reinvigorate the trials for existing vaccines that have not been released for public usage. It also brings together civil society organizations and other individuals who are volunteers, who want to contribute in research and development of newer vaccines through finance, through science and collaboration. And now if you look at another very upsetting development that happened earlier in 2025, it was in fact US government that had initially decided to give about $2.6 billion funding to Gavi. And it said, US said that we will be giving so much finance for the year 2026 up till 2030, right? That was a promise made, and this was a major amount. It estimated to be about 10 to 13% of the entire funding that Gavi received. But unfortunately, in a very poor turn of events, it was during June 2025 that America decided to withdraw funding from Gavi. Now, this is not a new thing. Back in the beginning of 2025, we also saw in the news how America decided to withdraw the funding towards United Nations peacekeeping forces. We recently saw how at the COP30 summit in Belém, Brazil, Conference of Parties 30, it was realized that countries like America have done nothing to finance the carbon financing mechanism. They refused to pay the promised $100 billion annually to the developing countries in order to mitigate climate disasters and to move towards renewable energy. Today, most countries want $1.3 trillion by 2035 as a part of carbon finance. But will that be done? We don't know. So here also in a very sad development, just like America withdrew from Paris Agreement 2015, it had also withdrawn from the Gavi Alliance. The US government had blamed Gavi in fact for having some scientific evidence that Gavi has ignored. It said that Gavi was into malpractices. It did not follow the protocols on vaccine safety during the COVID-19 pandemic. And it also tries to suppress the data. It was not transparent. That's the blame America put on Gavi. Just like recently, America had put some blame on Africa, South Africa. And the reason why America boycotted the G20 summit also, which was recently held in Johannesburg in South Africa. Now, whenever countries like US, that are the leading donor countries, developed countries, when they pull out of such global agreements, it brings to light another insecurity. Then what is the significance of various global agreements? That's a question that remains behind. Now, if you also quickly, as a fact for GS Paper 3, look at India's first indigenous malaria vaccine, which is a multi-stage vaccine because it tries to target two critical stages of Plasmodium falciparum. And the parasite which is mainly responsible to spread the most dangerous form of malaria, and the name of this vaccine is Ad-Falcivax. Ad-Falcivax, India's first indigenous malaria vaccine. And as per the Indian Council of Medical Research, the technology has been licensed to several companies in order to develop, manufacture, run proper trials, and then commercially start using the vaccination. The development of Ad-Falcivax is a part of India's agenda to eliminate malaria by 2030. Recently in the news, as we talk about the BIRSA 101 gene editing technology, I had also spoken about the sickle cell anemia and how India targets to remove it. So a very good question would be then, which parts of India is the sickle cell anemia more common? We had discussed this in one of our videos, so do let me know. Now a quick practice question for prelims to you. Consider the following statements regarding malaria vaccine and global vaccination efforts. 1. The reduced price of R21 Matrix M vaccine to about $2.99 US is expected to help Gavi vaccinate more than 50 million additional children against malaria by the end of 10 years. The International Finance Facility for Immunization provides upfront funding by converting long-term donor pledges, enabling rapid procurement of vaccine. That's slightly tricky. And third one, both WHO recommended malaria vaccines, R21 Matrix M as well as the RTS. They provide complete lifelong immunity towards malaria. So which of these statements do you think is or are valid? Let us know your answers. And before I take your leave, a quick reminder about a wonderful initiative coming here. We announce at StudyIQ the Achievers Sale, which means at a price of only 5,499. I repeat, at a price of only 5,499. A throwaway prize, you get in return a guarantee, a promise from our side, from my side, that we will prepare you for the Prelims 2026 in such a way that success will be a guarantee, because we offer not just GS paper 1 but complete CSAT. Lots of PYQs, MCQs and mentor guidance, one-on-one, an opportunity to learn from your favorite faculties on our platform. Price very affordable, and we will continue to engage with you till June 2026, much after the prelims. If you want to enroll, use code SPLIVE, SPLIVE. Please spread the word around. If you are the one who's writing prelims in 2026, enroll in Success in Prelims. Admissions ending 30th November. But then if you are studying for 27 or 28, we have similar offers for you at highly affordable prices, 12,499. Please use code SPLIVE, get a guarantee of prelims, mains, basic interview guidance. For 2028, the same thing. At a price of 3999, more than 15 months of strict training, proper aggressive training to clear UPSC 2028. For all GS, all prelims, every topic included, and the news and the answer writing too. How? Use code SPLIVE. It's one click away. Offer ends 30th November. So thank you so much.